So this is a possible scenario that we're gonna go through. So what I'm gonna do, hopefully, I'm gonna let you read for a couple of seconds. I'm gonna give you time to read, and then I'm gonna kind of go through it a little bit, and then we're gonna go to the next one, and then I'm gonna give you the same amount of time to kind of look at it, read it on your own time. I'm gonna go through it a little bit with you, and then go to the next section. So, here we go. Next section. So this is a possible scenario of Adam. So I'm going to let you look at it for a bit and just read it. So Adam, 40 years old. You know, he's a carpenter. You know, has always taken care of his health and appearance. Adam repeatedly turned down his friend's invitation during a phone conversation. He struggled off, and his lack of basically and the lack of engagement with his friends, you know, and could be more serious problem underlining what's going on. So there are a lot of things that happen with him, and that you can tell, and there could be other issue that's going on with him. So I want you just to think about it. What could be other issues that's going on with him? Just think ahead. What do you think Adam is going through at the moment? Okay. So we're gonna go to the next slide, by the way. Do you agree with Adam friends? So the question is now, do you agree with what Adam friend said about what Adam needs for him to go to therapy and all of that? What do you think about it? You can see there's a lot of things that flagged up regarding Adam, not socializing, him breaking up with his family. There's things there that you can see, but do you think he just needs time to just work it through? Or, because sometimes you just need some time alone, isn't it? To kind of, especially with men, to kind of process your own feelings and thoughts and see where you stand? Or do you agree with Adam Friend what he said? Just note it down what your answers are. So you know that later on, when you see the answers and we go through, you know where you stand. So just note it down for a second. I'm just gonna give you 10 seconds to just write it down. Okay. Action taken. So Adam acknowledged that he was feeling low and fatigued, and he would like to pass. He remembered speaking to he remembered speaking to he remembered speaking with a short-term counselor, having counseling, and a counselor who helped him during his divorce, and decided to make an appointment. So obviously he went back to counseling. The counselor felt that Adam might be suffering from mild depression, brought on by the negative or depressive thinking. So, thinking negatively, being his own, not socializing, you know, being alone. And remember, anxiety thrives on being alone, the unknown, not having somebody to talk to, the isolation. Those those are really things that we need to avoid. We always need to be busy. We always need to think positive. We need to be around other people that can change our thoughts as well, and thinking positive as well. Um, the fact that Adam was just about to turn 40 was also explored. You know, along with the stress of his certain his divorce, you know, the case that's going through, his children, his finances, all of these issues were discussed. The counselor and him were discussed. The counselor worked with Adam, helping him develop some new skills around more like around his thinking, giving him some helpful tools to read some books that might help him reflect and think more mindfully. Another thing that they could all counselors work differently. Um, you know, expressing about his emotion, giving him a place to talk about his emotion that can make him feel good, make him understand that what has happened to his life, acknowledging that. That's quite a good thing a counselor can do. Being in the moment, showing empathy, understanding, all of those things can really help somebody just come out from. Sometimes we all need just a shoulder to cry on, somebody just to listen to us, just to be vulnerable. Remember, we're afraid of being vulnerability. We're afraid of being rejected most of the time, and that can leave us really feeling alone. So one of the things that when you go to counseling, that you're facing your fears by talking about your feelings. You're able to be vulnerable, and you become stronger by being vulnerable because your needs are being met. And and then when you overcome that this person is not rejecting me and what I'm thinking about is normal, it helps you as well. They agreed to meet again to discuss if to they agreed to meet again if there had been improvement. Adam was also encouraged to follow up with his doctor for additional assessment and medical support. So again, sometimes when somebody's going through common mental health, everybody's different. Not one glass fits all. Some people might just need counseling. Some people might just need medication, and some people might need medication and counseling. And the reason is research has proven medication and counseling works 50 times more potent than just counseling alone or medication alone. But medication and counseling was shown to be equally effective. But when you use together, you're using double the you can double the effect as well. So it's encourageable and very good for counselor to kind of give the option, explore what you really want, and not just stick to therapy, but what suits you, what do you feel comfortable with. And each person is different, and that's good to explore that with your counselor. Results. After several weeks of focusing on replacing his negative thinking and positive affirmation with more result thoughts, Adam slowly began to feel more optimistic and less bored about life. He began to feel he began to feel that there was more things to look forward to gain, and that he could be an active participant in shaping his future. And that is, again, is changing that thought, isn't it? Having that place of not being alone, very important. And able to be vulnerable, because we all need to be vulnerable, we all need to be cared for. you know we can't always be strong, and it's normal just to be sad, it's normal to be weak, and it's normal to kind of feel like I'm okay, I can be vulnerable. And I remember, this one of the best time of my life, I think the strongest I've ever been is when I cried. When I cried in front of people, I felt and really like not crying like for the sake of vulnerability, but crying because I felt like it. I wanted to. It's giving myself a permission to say, you know, I matter. It's very important. Um, with the learning of with learning anything new, Adam had to put a lot of effort to practice, to practice his thinking, attitude. Sometimes you will fall back. Things do not go in a straight path, but overcoming that negative pattern and always going back to what's helping you, what's gonna get you there, and that's life, isn't it? Nobody kind of gets from one stage to another stage 100%. You're gonna fall back, but it's going back. Every time you fall back, it's going back to what got you here. It's about learning tools to help you. Especially with mental health, there's no cure for mental health. But what happens is when you go to therapy, you learn tools to bounce back. So what you're learning is how to bounce back quicker. It is not going to take you as long. You might just need a day or two to kind of process your thoughts and feelings, and then you get back to what got you there, what things that worked for you. And in a way, it's good to kind of connect with yourself as well, and just to take a pause in life. The effort paid off for Adam, realizing he was actually looking forward to his 40th, and celebrating the occasion with his family and friends. Gonna go to the next one. The signs. So what are the signs that Adam actually showed that he was spiraling, into mental health or depression, or what was the signs that you can actually look for? So turning 40. So that is again is that moment, isn't it? That a lot of us, when we get to a certain age, when you get 25, 30, 40, 40, is about you kind of reevaluate your life. Where am I? What's going on? And if you don't feel like you are in the same path as your peers, you can definitely feel like you have lost. The divorce, less time with his children. So it's like the thing that gave it could be like his identity as a father again could be shaken, because now what kind of father am I? I'm no longer with my kids. That can really have an impact on Adam. You know, his passion tend to boredom, definitely. Things that you once enjoyed, you're no longer enjoying it. You know, overall lack of enthusiasm. So that is again is changing of habit, isn't it? So that is the one thing that you have to know. So if someone is changing their habit, is a sign of like somebody's quiet and all of a sudden they're very you know they're very quiet. They like to spend time on their own, and all of a sudden, every night they're going out, every night they're drinking, or they're really like they're not spending time on their own. That's a sign. So if somebody's changing their habit, they're going from one extreme to the other. That's a sign of something is there, like they're running away to be with themselves. Low mood, distance, um, and denial of problems 100%. So we're all, as I said, we're all addicts one way or another. So we can find somebody's escaping from realize what's really going on. We can find many ways to escape. Internet, shutting down the world, escaping, going out every night, drowning yourself in work. There's many ways of escaping, but it's look at him. Is this person escaping from the reality? Are they not really facing what's really going on? So again, it's looking at that person as an individual and seeing how they're changing. What is it that they're doing that's having negative impact in their life? And anything can be a negative, if you do excessively. Lack of care of health and appearance, 100%. So if somebody's not really looking after their health and appearance, that means they really don't, they're not really in the mood in it. It's like everything is hard, everything is a burden. There's no excitement to look good. Why? What am I gonna look good for? I can't be bothered. Those things are definitely a sign. So hopefully what we have discussed about mental health, anxiety, depression. You can use, and able to be empathic, be in the moment, understanding like how emotion has impacted every aspect of our life. And one of the things I want to say realistically, I want you to take from this training is that maybe it's kind of common sense, but I don't believe common sense exists, is understanding one thing. Emotions is is one of the most biggest things that we have. There isn't any decision or anything that you do. Ask yourself this question. What do you do that has nothing to do with emotions? If you think clear enough, everything that you do is related to emotion. There's nothing you can do that's nothing to do with emotion. Yet, emotion is the one of the things that we give, how do you say, the least amount. And emotion is related to our self-esteem and who we are. And no one can say your emotion is wrong because emotions is something which is unique to you. And we need to explore and have in touch with ourselves and understand ourselves. And the more we understand ourselves, the more we're able to connect with others. What does Adam Friends could have done? Encourage what they could have done is encouraging him to work, to seek assistance, willingness to seek out help and take action, check in and check in more frequently, make their presence known and felt. Reminding him of the good times and good time that they had together. One of the things that I normally say and I learned is called the three knock. So not saying somebody how are you, they always say oh I'm fine, but saying really how are you, the person will hesitate. But ask them then really I really do care and I really want to know. Tell me how you're feeling. You're really kind of saying I'm here. So first of all, when you say how are you, person will say, "Oh, I'm fine." They'll just get that normal reaction that they talk to everybody. Say, "No, no, no. I mean, I'm really how are you?" The person might say, "No, I'm fine. No, I'm really here for you, and I really care." So showing that empathy, that kindness, that like I really want to hear what you have to say. I'm not going to reject you. I'm not going to just push you away. I'm here to listen. So the three knocks is very important, and that's what they could have done as well. Be making their presence known. That's what it meant. Really being there for him. Going to his house. Saying here we are, mate. We're not going anywhere. Come on, bring it instead of having eaten out. They could have take takeaways, whatever they're eating, and eat in his house, so they're actually there with him. Those are kind of things they could have done. Last but not least, so we just reached the end of it. Um, and this is our final PowerPoint. These are all the references for this PowerPoint. And well done to everybody that joined us. And congratulations. Thank you for being with me. Peace.